Hello you guys, welcome back to my channel. So today I wanted to update you guys on how nursing school has been. I know I've been wanting to update you guys for a while now. I know I've said it in my vlogs that I'm gonna update you guys. I haven't had to update you guys just because a lot has been going on. I did have my first exam for fundamentals and a really hard skills check off that I know a lot of people fail. So I was busy doing that. So I'm sorry for not updating you guys regarding nursing school. I know I always try to update you guys. Let me know if you guys really enjoy me updating you guys, or like would you guys like to see like more study videos. Just let me know down below in the comments. But I've been wanting to update you guys for a while now, but this semester you guys has been crazy. Basically there has been a lot going on, a lot of miscommunication between the students and the professors on what they want and what they do not want us to do. For example, we couldn't go to open lab if we didn't really learn the skills check off beforehand. That was like a little miscommunication. But basically for us, if we want to go to open lab, we have to be already taught the skills, and there was like a little bit of miscommunication between the students and the professors, which kind of makes sense, that why are we gonna go practice a skill that we haven't really been taught on. But some of us had applied to go to open lab that day that we were gonna learn that skills check off, and they were being a little bit iffy about that, but that whole thing resolved and we were able to attend open lab. So that was one thing. But another thing also was we didn't get to meet with our clinical instructor the day that we were supposed to meet with her, just because I think we were like the only group that we didn't meet with our instructor that day. And we had assignments due that we 3 days later, and we didn't even meet with our clinical instructor the day we were supposed to. And then like we were all freaking out because we had an assignment due, and I had to email my professor from lecture and let her know about what was going on. I think I had to send her like the longest email ever regarding what was going on, and letting her know that we didn't meet with our clinical instructor. We were supposed to meet with her online, and then we had assignment due, and then we had a discussion post that we didn't even know nothing about. They had changed the due date from the discussion post from a Tuesday to a Monday, and I was so used to the discussion post being due on Tuesday, but they changed it to Monday without even letting us know. And that was a little bit confusion, just because we're not always going to be on campus 24/7. But I after I emailed my professor, there was no more miscommunication and none of that. She was straight up telling me to not worry, and I got some clarification also, so that was a good thing. And basically that is what happened. And then I had my first fundamentals exam, and that was yesterday. So that exam went well. I did pass, but I feel like for me personally, I needed to do more practice questions, figure out what is the first thing that the nurse should do, because I feel like I kind of got confused on that when it came to answering the questions. Our exam was on Zoom through camera. So that's something new, just because last semester we didn't really get to be on camera or none of that, but we did end up getting less time. So this time we were on Zoom, something new for us since we're not used to it, but that's what's going to be for the rest of the semester. We're going to be through this whole new program that's provided by the school for our next exam. So I'll keep you guys updated on how that is. So yeah, yesterday after my exam, I had to go to open lab, to practice my skills check off. I did have a skills check off today. It was for Foley catheters. I heard from other students from the previous semesters that skills check off was the hardest one, and that a lot of people tend to fail that one. And that it's okay if you do fail that skills check off, just because, you know, we were taught through video and then we came in person and our instructors showed us, but they didn't really show us, if that makes sense. Just because there was also confusion with like the students. Like, you know, we would go to open lab and then they would say one thing and then we would practice it on our own, and then we would just, there was just a lot of confusion. And, you know, I would go off of the videos that they had provided us with, but it was just a whole bunch of confusion. And, you know, I feel like a week is not enough time to like practice that skills check off. And, you know, the area where we performed our skills check off today was small. They had us all in one room and there was like a total of 6 instructors in there. So yeah, you can overhear other people's conversations. My area was small, and, you know, to do a stereotechnic procedure in a small area, it's hard, just because, you know, you're trying to maintain to be in sterile field, but, you know, it's hard, you know, because you have to not turn your back, or you have to avoid like cross contamination, like having your body over the equipment and stuff like that. But yeah, I did have my first skills, my skills check off today. I got there at 11 and I finished at 12. I only had 20 minutes to do the skills check off, you guys, and the whole skills check off went wrong. So I was starting good with my skills check off. I put on my sterile gloves. They went on perfect. That was like, you know, something that I was worried about, you know, not being able to put on the sterile gloves. You know, I was doing the whole procedure correctly, and bam, I had touched the patient's area with my sterile hand. And, you know, that area, you never know if that has an infection. So when you touch that area, basically you fell. So for some reason, I don't know why, I wasn't paying attention that I touched the area, and I didn't realize it until my instructor pointed it out. My instructor was like, "Ooh, you just touched the patient's area." So I was like, "Did I?" But for some reason, I was just super nervous. I was anxious. My anxiety was bad. My hands were shaking. This hand mostly was shaking. It was like literally shaking of how nervous I was. So she told me, and she's like, "You have to redo the whole entire procedure again." So, you know, I had to tell my patient, like, "Oh, I'm so sorry. I'm unsterile now. I exposed you. You know, so I have to restart this whole entire procedure. I have to get new equipment. You know, I have to get a new Foley catheter. I have to get new gloves." And basically that's what happened. I got a new kit. I got a new gloves. I did it again. This time my gloves, you guys, would not want to go on. For some reason, my thumb area was like right here, and I couldn't. For some reason, when you're putting on your sterile gloves, you have to put them like this, and my area for my thumb to go in was over here. So like I was having difficulties. My hands were shaking and sweating. So I had to tell my instructor, like, there's no way that I can turn around the glove so it can fit my thumb without me touching the whole entire glove. So she ended up telling me that I can use a new pair of gloves. So I used a new pair of gloves. That took up more time. And basically, you know, I was able to put on my gloves. Perfect. And, you know, I continued on doing the procedure. I touched the patient's private area again. And the professor told me, "Do you know what you're doing?" And I was like, "Yes, but you did something you were not supposed to do. Touch the patient's areas with your sterile hand." And I was like, "Okay." But for some reason, my mind, like, I didn't really know what she was trying to tell me. And I was just like, "Okay, yeah." And then I continued on with the procedure, because she told me to continue on with my procedure. And then at the end, she told me, "You failed. You failed the skills check off." My anxiety was bad. In the middle of when I went to go get my new gloves, I literally wanted to cry because I just wanted to give up. Like, my anxiety literally took over me, and I literally wanted to cry, you guys. And I had to hold myself together and be like, "Nope, you are not gonna cry. Your anxiety is not gonna get bad." So I went back in there, and then, you know, continued on with my procedure or whatever. But when I was sitting down and, you know, she told me that I failed, I was just like trying to get it together, not crying. I was just like, "Okay, So like, when do I have to retake it? Do I have to go to open lab? What's gonna happen? She goes back and talks to another instructor, tells her, my situation. Basically, I did the procedure good. Like, I knew what I was telling the patient. Like, I was really well educated on sterile, on the whole procedure. I knew how to talk to my patient. I knew what education I had to give my patient. I knew what I was doing, but it was just me touching my sterile glove in the patient's area. So she went to go talk to another professor. She came back. She told me that they were not failing anyone, that I passed. So at the same time, I still was I still wanted to cry, because hearing from your instructor that you failed is like one of the worst things ever that you can ever hear. So I was just like, okay. And then she's like, I just want you to do the procedure again right here and show me how you're supposed to do it. And I was just like, okay, I'll do it. And I told her, like, how am I supposed to do it? And then when she did it, I was just like, I know what she's talking about. I was like, I knew that you're not supposed to touch the glove in close to that area at all. You're supposed to be a little bit further and just, put it in. But I was close to the area, putting it in and touching the area, that I realized, what I was doing wrong. And I was like, okay, I realized it, I did it. And she's like, yes, like, you got it, but like, what happened? And I was just like, I just don't know, like, what happened. And she just told me, like, communicate with me. And she's like, if you don't communicate with me, then I don't know what's going on in your brain. So I learned, and I was just like, okay. But you guys, I know that I wasn't the only one that went through this. I talked to another classmate, she went through the same thing. And there was a lot of people that made mistakes, people that weren't sterile. There was like a lot of things that happened. And like, this is more like a learning experience that I learned today, and that I know not to do again, and to practice more, to remind myself, like, what I'm supposed to do and what I'm not supposed to do. Because I know that I wasn't the only one that went through this today. And I know there was other people too that had their anxiety up. I know there's people that probably cried. I know there's probably a lot of people that failed, but they did pass us. And I did learn from it. And that's how basically my experience was. I wasn't really going to talk so much about it, just because, you guys, I just do not know if I wanted to really talk about it. But I'm just gonna talk about it and just let you guys know how it went, because I know that there's probably other people that probably have gone through this. And like, why not talk about it? Like, I know now that nursing school is hard. From this whole entire week, it was hard for me. And I've learned, and I know next time what not to do and what not to do. Basically, a couple hours later, I got home and stuff like that. I checked my grade, and she gave me full points for the procedure, for the skills check off. And I literally wanted to cry, because when she told me that I failed the first time, basically I was just like, you know what, I'll just go to open lab. I'll just come back next week and do it again. So that was my plan. But she gave me full points, and for me, I just expected to get the lowest possible points that was required to pass. I'm guessing like the lowest was 19 or 18. I'm not 100% sure, but I was just like, you know what, if I get the lowest points, then who cares? If my grade goes down, then who cares? Today was a learning experience. But yeah, that's how today went. And basically this week has been hard for me. I'm so drained, but I do have postage and calculations exam in 2 weeks, so I have to prepare for that. So I'm going to be preparing for that, and I'll bring you guys along with me on how I'm going to be studying and stuff like that. But yeah, you guys, that is the update that I had to give you guys. I know it's long, this video is probably super long, but I did want to update you guys on everything that has been going on. And yeah. And you know, like how I said, I'm always going to be honest about nursing school because I know nursing school is not going to be easy. And yeah, it's basically it. I'm hoping you guys did enjoy this little mini update. And you know, of course, don't forget to like this video, subscribe to my channel if you haven't, and follow me on Instagram. And yeah, that's basically it. And I'll see you guys in my next video. Bye, you guys.